I'm going to hand it over to Victoria Wright with the administration for community living, who's going to kick us off.
Thanks, Haley. Good afternoon, good morning for those who are on the West Coast. Welcome and thank you for joining us today for our third VDC Office Hour session, which will focus on managing VDC invoices and supporting timely billing. For those who are not able to attend the second session and are interested in viewing or hearing our first and second session, we have the slide deck and recording available on our No Wrong Door website. So please, please let us know if you need help navigating on our website, and just send us an email and we'll be happy to help you out. For today's agenda, next slide, please, Haley. For today's agenda, we will do a recap of our last session, reviewing key takeaways, and we will touch on some of the questions that we were unable to answer. We have the Bay Aging to share their best practices for timely submission of VDC invoices and strategies for follow-up if experiencing billing issues. Then we will have our focus topic discussion, managing VDC invoices and supporting timely billing. And lastly, we'll open it up for a Q&A for question and answer. Before I turn it over to Pat, please, we would love to hear from you. So you can please use the chat box for any question you may have, and as well as you can use the raise hand function if you would like to use that. So for now, I'll turn it over to Pat. Pat, the floor is all yours.
Thank you, and hello everyone. It's great to be with you again for our third office hours session. You'll notice we've had a flow. We started by talking about authorizations and assessments. We transitioned to spending plans and monthly service reports. And today we're going to focus on billing and invoicing. But whenever we've done these office hours, we hear from you. We get your questions. We're able to answer a number of them. Some of them we need to come back to and talk about a little bit more. So we're going to spend the first part of our time this afternoon talking through and just recapping what we learned in session 2 and a few remaining frequently asked questions. So again, mentioning that our last session together, session 2, focused on monitoring veteran spending and using the monthly services report. Now, the monthly services report, as a reminder, is the document that's completed monthly that summarizes all spending that actually occurred in that given month. And all that spending that's in the service report, the monthly service report or the MSR, should align what's in the veteran's spending plan, which is that plan for how the veteran will use their budget. So we have templates for the MSR, the service report, as well as the spending plan. Please take a moment, go back, look through those resources. If you haven't done it, we also need you to read the VDC billing and invoicing guide. You'll also see on the right lower hand side of the slide that we have the recording as well as a summary document there for you to review. If anything wasn't clear, if you or a colleague were not able to come, or if you just want to go back and listen to it. So please leverage that when you can. Okay, we can go on to the next slide. What are some general takeaways that we wanted to reinforce? So the first is, what are you using to monitor and track actual spending, compare it to the spending plan, use that to support developing invoices, and to track how much the veteran has spent over the course of their authorization. We've reworked that template that you can adapt, adopt, incorporate into your local policies and procedures, or you can use something locally. But we do have some minimum requirements for what we want to see every monthly service report have. We also know that this is a collaboration, particularly for our VDC providers who are on. Your FMSs play such an important foundational critical role in monitoring spending. So we need you to work with your FMS to have a process for updating, for developing monthly service reports, and who's responsible for tracking, looking at spending, identifying where there may be issues that need to be followed up on. Another thing, we need to make sure that we have a level of specificity in the spending plan that may not have existed before. Mainly in the spending plan, we want to go into a lot of detail around the schedule that veterans have their workers work. Let me kind of say that again. Before, in the spending plan, maybe you were just saying, hey, the veteran's going to have this worker and they're going to work 40 hours per week. That makes it really difficult to understand how veterans will spend their money. Makes it a little bit tricky to track. So in the spending plan, what we're now encouraging in the template is where you would say, this worker is going to work these amount of hours on these days and provide these types of services. So that way, when you actually look at timesheets, if the veteran, it becomes a lot easier to be able to track and understand the root causes between overspending and underspending. So we really want to focus here on a level of granularity in spending plans that likely did not exist before. Okay. And I will be monitoring for questions. I see one came through, and we will come back to that. So those are just a few takeaways. Keep those questions coming through the chat, and let's start going through some of the FAQs. And we're going to start with a really tricky, important question that came through. We're going to spend about 5 minutes on this. This happens in most situations. So let me present this to you. How should spending plans be developed if it takes time for the veteran to develop a plan and begin using their budget? So let's use an example, because unfortunately we need some math to come through. Let's say a veteran is referred on day one for a 12-month period, so 365 days or 12 months. And let's say their global budget, the amount that they have over the course of that year, is $24,000. So their average monthly budget would be $2,000. Okay. But if this is a new referral, veterans don't start using their budget on day one. There's an assessment. There's a period where the veteran's going to identify workers. There's a period of time once a worker's identified to complete employer paperwork, to hire, to train that worker. It could take time to just submit that plan and have it approved with the medical center. So the question is, how should we be basing the veteran's budget? So if they have $24,000 over the course of the 12-month period, well, what if it takes them 30 days before they actually begin using their budget? Well, now there's 11 months. And we learned in the last session and in our first session that veteran still has $24,000 available. But the way the spending plan should be developed is we should be thinking about the average amount of money the veteran is going to spend per month over the course of the authorization. So that doesn't mean that the veteran is going to spend $2,000 every month. They may have one-time goods and services. They're going to maybe want to make sure that they reserve some spending for emergency or backup care needs. But when you think about those 11 months that are remaining, or however long is remaining, we want to think about the average amount per month. And that should equate to the amount of money over that course of the authorization. So let's talk through this example. So in the first sub-bullet, you'll see 12-month period, $24,000. That's $2,000 a month. takes 30 days. So we only have 11 months remaining. Well, we still want to make sure that that veteran is targeting about $2,000 per month total over that 11 months. So that would be $22,000 over the remaining 11 months, even though they're authorized for $24,000. I'm pausing very intentionally to let that sink in. We have a couple more slides to really talk about why this is. So we know historically about 20% of veterans are discharged from the program in the first year. And we can move on to slide 8 now. So 20% of veterans are not enrolled for a full year. But a number of them historically are going to stay in this program as long as they can remain at home, which could be several years. And we want to make sure that if they are reauthorized for the program, their spending plan doesn't need to be reduced in the future. So why would that be? Well, let's go back to that example. On average, the veteran's budget is $2,000. So let's say for a minute in the previous example, I'm being very intentional with how I phrase this. Let's say in the previous example, you said, okay, well, that veteran's going to spend, we're going to allow them to maximize the use of that $24,000 over the remaining 11 months. They would have spent over $2,000 per month. I think right here, I'm basing it off of if they would have spent $24,000 over a 10-month period. So that would have been $2,400 on average per month. Some months it could have been higher, some months it could have been lower. But if that veteran is reauthorized at that same case mix level, their budget in that next 12-month period is going to be $2,000, which means we're now going to have to change their spending plan and reduce it by a pretty significant amount. So now that veteran has maybe been getting X amount of care for 11 months. Well, now once they're reauthorized, they're actually going to get a smaller amount of care. And we want to avoid that from happening. So again, let's try to remember a couple things. Then I'm going to go to the chat on the next slide here. So what do we know? We know that VA is not obligated to pay for any expenses over the authorized budget, which in the example would be $24,000. But all spending needs to be included in the spending plan. And we want that spending plan to be detailed. It should estimate, you should very easily be able to figure out in that spending plan based on recurring services, one-time goods and services, emergency backup care. Here's how much the veteran's going to spend. You figure out how long they're using their budget for. You can very quickly calculate and figure out what's the average amount spent per month. And we need to be basing spending off of that. Even though the veteran may have more money authorized, it's really important that we think about long-term if those veterans remain in the program, not putting them in a situation where they're going to now rely on that care that may not be available in the future. Okay. And this is great. So I'm going to read this out loud because this is a takeaway. We update, and this is a comment from one of our attendees. We update and change spending plans several times during the course of the authorization based on the reality of spending to compensate for planned overspend or planned under, I'm sorry, to compensate for planned or unplanned over or underspending in certain months, right? So if we think about that, that means we have a plan. We are reevaluating that plan continually over time, and we may need to adjust it accordingly. So that's a great comment. Thank you. Okay, here's another question. I'm just going to read it out loud. If spending plan does take 30 or 60 days to complete and approve, should the months be altered to reflect the prorated months and amounts rather than the 12 months? If we keep it at 12 months, will this cause confusion to the veteran? So that's a good question. I think I follow it. So I think if you go back to the spending plan and you look at the spending plan, there are several tabs and categories of care in the spending plan. So there's recurring services, there's one-time goods and services, there's emergency backup care. And so if you think about this, this is really, not looking at month by month over a 12-month period. This is showing what they're actually doing on a pretty routine basis. Like, hey, here's your schedule of care. You have workers coming on Tuesday and Thursday mornings, and Monday and Wednesday and Friday afternoons. Here's who's coming on the weekend. Here's how much that costs. So there's a lot of detail in there. And really, I know we look at things monthly, but most schedules come down to weekly when you think about that. Workers are generally working a weekly schedule, and they should know that, the veteran should know that. And then we can estimate what that costs per month and think about what that means for the veteran's authorized budget and their average monthly spend that actually is going to occur. I hope that answered your question. Let us know if it doesn't. Okay, and there are going to be some local differences here. We understand that. We need you to work collaboratively. Your FMS provider, your VDC provider, your medical center, you're a part of the team. So there's a comment here that their local practice is that they generally have a 30-day assessment fee, and then the plan is to start using the budget on month 2 and last for 11 months. So that's obviously something that works locally for them and is something that has been developed. And so we would encourage those local practices. We'd be very interested to learn about them too, to understand what are you doing. If it's a best practice, we want to replicate that across the system. Okay, and another medical center actually changes the authorization to match the actual dates of paid care. And if you're remembering, we did talk about that in the last session. Go back and review those slides if you're interested about how authorization can be done based on these situations. Okay, let's keep going. We spent a lot of time on that. We have a lot of other content to go through. There was a question about reviewing MSRs, and want to talk this through. If you are a VDC provider, you should be developing monthly service reports. It's called the monthly service report for a reason. You should be keeping those monthly service reports and sending them to your VA medical center if you're a VDC provider. Now, VA medical centers should be reviewing those too, but it's a different type of responsibility for the VA medical center than a VDC provider. If you are a VDC provider, that monthly service report needs to be looked at and analyzed every single month. Overspending, underspending. Is there something going on with the veteran that's alarming? They have an immediate care need and they're using their budget to fill that. We need to identify that. We also need to think about what it means for their budget. Why are they underspending? So we need to be looking at that monthly. If you're a medical center, they do not have that same requirement necessarily. So they may want to know if veterans are following their spending plan. They may review it periodically, but it may not be at the level of detail that VDC providers should be reviewing it every single month. Okay. On the next slide, we're going to talk just a little bit about mid-month authorizations because this came up. Very similar to that first situation. Veterans can start using their budget. They can get referred to the program any day of the month. It does not need to fall on the first of the year. We need to be thinking about, again, average monthly spending. And your spending plan will allow you to calculate that average monthly spending. So there's no issue with veterans using their budget in the middle of the month, starting to use their budget in the middle of the month, referring over in the middle of the month. We need to be thinking about that spending plan based on average monthly spending. We need to make sure that it doesn't exceed the global budget. Couple questions about the administrative fee. Okay. It is correct. So the monthly administrative fee is billed when the veteran uses their budget. The requirement is that the veteran has to use their budget to receive personal care services at least one day in the month in order to bill for the admin fee. Everything that happens before the veteran uses their budget is intended to be captured in the administrative fee. That includes helping the veteran identify workers, developing the spending plan, helping them train workers. So all that is covered under the assessment fee. The monthly admin fee comes once the veteran starts using their budget. And we'll talk about that more today. Question about hospitalizations. So we have an example here. Want to talk this through. This has come up a lot in the program, but what do we do for our monthly admin fee if a veteran is hospitalized? Well, the requirement is that the veteran needs to receive personal care services using their budget in the month in order to bill the admin fee. Now, the admin fee is never prorated, okay? Always paid in full. But we need to think about what this really means. So yes, a veteran could be admitted for 60 days to a hospital, continue to be enrolled in the program. Now, if those 60 days, it may very well only cover 1 month in which you can't bill the admin fee. So if you think about a hospitalization from May 15th to July 15th, if the veteran uses their budget in the first part of May, the end of July, you can receive the admin fee for both of those months. It's only the month of June when the veteran is hospitalized that you're not. Let's say a veteran is hospitalized for 30 days. If that 30 days falls from May 15th to June 15th, you may not miss any admin fee, because if the veteran used their budget in May and June, you'll be able to invoice for both months. So we need to understand that. We understand that, you know, in terms, hey, you may have subcontractors, you may have an FMS provider who's based on a per veteran per month. You may need to look at what procedures do you have in place. And we can talk about this more as well. Okay, just a couple notes then. If a veteran's in a hospital, we need to be evaluating their needs before they're discharged. I'm sorry, once they're discharged. If their needs are different, if they've changed, if that change is particularly not short-term, as in they're, you know, not in a rehabilitative state, you know, maybe post-surgery or post-op or something like that, but this is now a long-term functional change, we need to be identifying that. Veterans should not be using their budget during a hospital stay without prior approval. There are very limited circumstances when that would be approved. I cannot cover every circumstance, so it's hard to have a hard and fast rule here. But let's say a veteran lives alone. Let's say they're coming home tomorrow. Well, you know, maybe a worker needs to stock their fridge, pick up their medications, so they can come home to a safe environment. And so there could be instances where, you know, the day before, the same day of discharge, care would be needed, but it needs to be approved by the medical center beforehand. So please think about what that means and develop policies as a result. Okay, we'll stick with hospitalizations. We're going to do underspending and then overspending. Hey, if a veteran's in a hospital, we know that they're going to underspend for those months. That's totally fine. There's nothing that needs to be done as a result. If the veteran's needs don't change after that hospitalization, they just go back to using their spending plan. But again, making sure that they're not using their budget while they're in any inpatient setting. Okay, overspending. So want to make sure that this is very, very, very clear. It's a responsibility of the veteran with support from the provider to manage their budget. That needs to be done every single month with the veteran. So every month we should be looking at spending, comparing it to the spending plan, working with the veteran accordingly. If you're doing this continually, it should not sneak up on you in the last month or two that the veteran is not going to have money left in their budget. If you're tracking their budget, we're going to be proactively identifying concerns. If a veteran does go over their global budget, you're going to need to work with your medical center, but medical centers are not required to reimburse for any spending that exceeds that amount. So if the veteran has workers and it's not reimbursed, that's going to fall to the veteran. It's ultimately going to fall to the veteran. They are the employer. So we need to be supporting them in that responsibility so that this does not happen. It should not happen if we track this every month, except in rare circumstances when the veteran just blows through their budget in the last month. But most of the time, it's a result of them blowing through their budget earlier in the year. Okay. We can go to the next slide. Hiring employees. Just want to be clear. You have to follow all of your state, federal, local rules and requirements with regards to hiring workers. So if it takes a period of time to hire workers before the veteran can use their budget, that's a consequence of needing to follow those rules and requirements. If there's a care need, we need to be working collaboratively. Can we use agency care temporarily? Can the VA provide any services to that veteran? All right, our topic for today, billing and invoicing. Let's jump right into this. I'm extremely excited. We're going to start just like our other sessions by highlighting one of our just leading VDC providers in their local practices and processes. So I'm really thrilled. We've had just an amazing group, and today we get to recognize Bay Aging, based out of Southern Virginia. And with them, we have Jennifer Beck, who is the Director of Community Living Programs. Jenny is here, and thank you, Jenny, as well as her colleague, Penny Smith, the VP of Business Development for Bay Aging. Just want to recognize that we have both Jenny and Penny here. I love how that kind of rolls off the tongue, but they're part of a broader team. Melissa Blake, who's their Veteran Directed Care Administrator, couldn't be here today, but her, as well as others at Bay Aging, including Kathleen Vesley, their CEO, just do incredible work for veterans. So welcome, Bay Aging, Penny and Penny. And I just want to start with, maybe one of you don't mind just introducing Bay Aging for the rest of us. Maybe talk about your roles in VDC, who Bay Aging is partnering with, how many veterans you're serving.
Hi, Pat. This is Penny Smith. Just to share a little bit about Bay Aging, we now operate under two different roles with the VDC program. Our history has typically been as provider, and then more recently, we began to offer FMS-only services. Just to share a little bit about each of these roles, as provider, we started with the VDC program in 2009. And then and we were initially simply a provider. And then in 2011, we became a certified financial management services provider. As the provider role, we currently serve just under 300 veterans. We get to partner with 4 other AAAs who provide options counselor services beyond Bay Aging's geographic area. And under this role, our coverage spans 6 states. We work with Hunter Holmes McGuire VAMC, Hampton VAMC, and East Orange VAMC. And like I've shared, more recently, we have also added the hat of FMS only provider. That was in 2019. And in this role, we work with just under 50 veterans, and we are a partner to Mid-America Regional Council, which is a AAA in Kansas City. And this coverage spans 2 states. Under this engagement, we work under the direction of the Kansas City VAMC. So in total, we assist around 350 veterans, and which span 8 states, and we are under the direction of 4 VAMCs.
Thank you, Penny. And just amazing to hear the scope of Bay Aging's involvement in serving veterans across the country, not just where you are locally. Penny, wondering if you want to describe your processes for developing and submitting invoices. So to kind of frame this for everyone else on the call, really thinking about, okay, we're at the end of the month. It's now the first of the month. So what's your process? What kind of deadlines, what kind of systems do you have in place to develop and submit VDC invoices?
Well, we actually use a very detailed process for developing and submitting those invoices. Prior to completion of a current payroll, we initiate a payroll task checklist with our options counselors and the FMS staff. This is a helpful tool to keep all parties well informed and so that we all operate under the same guidelines. This list includes due dates, which are assigned and tightly observed for each task. And this helps to ensure accuracy and timely data. As we capture data, it's immediately entered into the spending report, as it occurs. And this serves as a check for correct information and a valuable safeguard for budget compliance, as you've already shared much about. The options counselors also have real-time access to all spending reports for those clients that they serve. And they find that this is a very valuable tool as they work with the veterans to, again, help keep them on track for budget usage. Our VDC invoices are prepared and submitted by the 10th of the month following completed payroll. I want to add here that we utilize a bi-weekly payroll schedule, which can create varying payroll completion dates. So again, we target for the 10th of the month following payroll completion. We submit these claims electronically. And in the past, we did utilize a more manual system, but we have realized a huge success by switching to the electronic platform. We find now that our turnaround time for payment of claims is within 10 days of submission. So, we just can't speak highly enough of that success. It's been a real win for Bay Aging. After everything is completed and the billing is submitted, we prepare and send out monthly statements to the veterans or their authorized representative. And this provides for them a monthly snapshot of where things stand, what they have available, how much they've spent in a given month, what the budget is. So it keeps everyone well informed and on track. If we compare what I've just shared in the provider role with strictly the FMS side of the house, we prepare that file within 15 days of completing the payroll process. And we share that with our partner, and then they in turn submit it to the VAMC. In addition, we provide them with, in addition to the claim file, we provide them with spending reports, timesheets, vendor invoices, UB04s, and the veteran statements, which we mail out to the various veterans. And then, of course, in this role, we're there to assist with any claim corrections as they may be needed.
That's incredible. Thank you, Penny. So Penny, 10 days, that's incredible. So obviously you have a system for tracking this proactively. So, after that date that you've submitted an invoice, and you're always striving to do that as soon as possible following the end of the month, while making sure that you have everything that you need to submit complete and accurate bills. What's your process now for monitoring those invoices once they've been submitted?
Well, what we do is we reconcile the accounts receivable as VA payments are received. So, obviously we're looking for, we'd love to get full payments, but on occasion there are partial payments. So we rely on those EOPs or explanation of payments to assist with identifying variances. As we identify those variances, then we use the VA guidance for resubmission of any partial or corrected claims. I'd like to add here that Bay Aging was selected as an early adopter for the provider portal, and we have found this to be a valuable tool. It helps us with various resources online, real time. So for example, we're able to pull the EOPs, the explanation of payments. We're able to pull a list of all payments that were made in a given month. We're able to access a monthly summary of payments, and we're also able to look back at historical payment information. So we can't speak highly enough about that tool. And then also we now have access to the Health Share Referral Manager. And this is a site where we can actually locate and reference authorizations. What we have found with this tool is that we're able to look through the authorizations and to catch any issues that may create a variance when billing versus payment. So this tool has very much helped us to act proactively and help to prevent any exceptions to what we bill. But overall, we have fabulous tools out there. We have had a wonderful experience, and like I shared, we were delighted to go to electronic billing. Now with these additional tools of the provider portal and also the Health Share Referral Manager, we certainly want to draw attention to the VA coordinators because we have found that they are our best tool. They help with general questions, they help with problem solving, and so we are just delighted to have this opportunity to work with such a fabulous group of coordinators.
That's great. Thank you, Penny. Just wanted to highlight a couple things. So you mentioned a couple tools. Want to make sure that I caught them. So health services referral management, I believe HSRM is the acronym or the initialism that you use, HSRM, as well as the Customer Engagement Portal or CEP. Those were the two resources you mentioned, Penny. Did I get them?
They are resources, but there's, they certainly provide necessary information, yeah.
So if you want more information, please take a look at the billing guide that's online. We have information links to both of those. You can get explanation of benefits in CEP. We do have several links, several training documents that are listed in that billing guide for those resources. So if you have access to them, there's an opportunity. If you do not have access, because we know that some may not, it's being rolled out, phased in. I believe it's close to being fully implemented, but if you're not, we need to make sure that you're looking into when that will become available. And as soon as it is available, leveraging those resources for accounts receivable and invoices. So if you have any questions about the provider portal, please do let us know. The Veteran Directed Inbox is a resource there. The theme of all of our calls is using these strategies to provide better services to veterans and caregivers. So Jenny, Penny, I'm wondering, could one of you talk about, hey, what do these processes mean for veterans and their families? Can you provide an example of when it's had an impact?
Sure, Pat, I'm happy to do that. This is Jenny with Bay Aging. I can speak to our processes, and as a veteran-directed care provider, I think it is a great benefit to our veterans that we serve to have both our case management and FMS in-house. This allows our options counselors access to budget information, the monthly spending reports, all of that in real time. And it equips our options counselors with this immediate information so that they're best able to advise veterans on budgeting their time, chore services, or any questions that the veteran might have related to their budget or spending plan. And we found with this type of support from both the OCs and the FMS team, we actually have veterans, one in particular I'm thinking of, who is able to meticulously manage his budget down to the penny every month. There is no carryover, and this is empowering him to have more choice and control over his healthcare needs. It gives him a sense of responsibility in being the employer, or basically managing his own small business. He is budgeting appropriately and reviewing and approving timesheets. And that's really empowering him. Additionally, it's helping to supplement their household income because his wife is actually his employee. So we found for us the process of having both the case management FMS in-house is just such a huge benefit to us and to the veterans we serve.
Thank you, Jenny. Oh, that's incredible to hear. So, the takeaways here. Let's not forget what a self-directed model of care like VDC does. It's about empowering veterans, individuals, to have choice and control over the services that they receive. That means that they are an employer, no different than a small business, just like what you said, Jenny. We need to be educating, making sure that veterans are aware of what their responsibilities are and what it means, coaching them up to be able to engage in managing this. And then the caregiver side of it just had to reflect on, you know, hey, that spouse, that caregiver is an employee now. They're filing Social Security annually. There's unemployment that the employer is now paying for them, should they not be an employee at some point in the future. Most of those roles are in the direct service workforce are very frequently unpaid. So there's an opportunity here. And veterans get to live both as an employer and support their employees. So thank you for sharing that story. To the penny, the veteran manages their budget. That's a high bar to set for our other 3,500 veterans who are enrolled in this program. Okay. Thank you, Penny and Jenny. I really appreciate you. If others have questions for our the aging colleagues and partners here, please feel free to use the chat. We'll make sure to get those questions to them. Okay. Now, so we talked through a number of things that we're going to kind of, with the aging, that we're going to come back to in our FAQ style. So the first is, hey, we really need you to read the billing guide, go through that step-by-step process to do everything that we can to ensure that you're paid. And for aging, that's frequently 10 days. But we know that there may be some instances where you're not paid in 10 days, even if you do everything right. But we need to make sure that we're following the guidance in the billing guide as a start. So one of those requirements is we are invoicing based on the days of the month in which the veteran receives personal care. So that daily rate is based on the total amount spent in a month, which is all services plus the monthly admin fee. It's divided by those number of days and then invoiced on those days. So if a veteran receives care on, you know, only the odd days of the month, we're going to calculate the odd days, and then we're invoicing only on those odd days, not for every day. And it's those days in which the veteran receives personal care services. But we know, you know, there are times in which the challenges do arise. You get a rejection, you get a partial payment. Well, what do I do here? We'll go through that on the next slide. So the first, we do need you to look through those EOBs, those explanation of benefits of payment, particularly if you know you have your rejection code. You can log into CEP, the customer engagement portal, to look at them, and then we're going to go from there. So the first, we have a couple of resources here. So an explanation for common rejections. We have a link for that, as well as if you are submitting paper claims, we are really pushing and encouraging for electronic submission. But if you are, there's also a fact sheet for that. And we have those links here. Okay, moving on to the next slide, we're just going to talk about one of those rejection codes that we've seen crop up recently, and it's a subscriber or subscriber ID. So it'll say, you know, invalid subscriber or subscriber ID. Now, we'll follow up with more guidance here in the future, but just a couple tidbits. First, the subscriber ID is most commonly, it's the veteran's Social Security number that's added there. Now, the guidance from VA is to include the full SSN, not the last four, the full with no dashes or spaces. So you're just including that, just the full 9-digit code, SSN of the veteran. There are some electronic checks where maybe some months you can have dashes and other months you can't. So we need to make sure that when you report the SSN, no dashes, no spaces. And And what we're trying to make sure of, and we will follow up on this more, there may be very, very limited circumstances when the subscriber ID would be something other than the veteran's SSN. Most commonly, it could be if the veteran is enrolled in Medicare and they have a Medicare beneficiary identifier, or an MBI. Now, the reason why this happens is because the VA can actually bill insurance companies, and they do this, and it's a lot more than you would expect, where they would be billing Aetna or another healthcare insurance company because that veteran has insurance, and they're going to the VA for care for something that's not service connected. So in those cases, the VA can deliver care and actually bill those insurance companies just like any other provider caring for an individual. Now, if the veteran is enrolled in Medicare, they may actually have on file the veteran's MBI, or their Medicare beneficiary identifier, in which case that would be used. So we're trying to find out a way to make sure that that's clear if that's what's going on. For now, we would want you to follow up with your medical center. They should be able to look up the veteran subscriber ID. If you're still having issues, we'll talk about what to do there as well. Okay, let's keep going here. Now, this cannot be stated enough, but on every single authorization, on every single invoice, we need to include the authorization number. We have instructions here for you. Please use this. The authorization number must be included or it's not going to get paid. Our next question that came through is, well, when should we be invoicing for VDC? There is a hard rule that needs to be clear. You have to invoice within 180 days if you have a veteran care agreement, which VDC providers do. You will not get paid if you let more than 180 days go. And that's for the first claim, to be clear. So if you're having trouble getting paid, if there are rejections, the VA is using that date in which you submitted the first bill. We need to be resolving those issues quickly. We understand that too, but need to be clear that first invoice needs to be going in 180 days. But in reality, we should be targeting 30 days or less. There may be times in which 30 days is needed, particularly on how pay periods are structured, but 30 days should be a general rule of thumb. And we need to be cyclical, meaning we need to be billing every single month and then starting over again. So we shouldn't be doing batches, meaning we're submitting June, July, August all at once. We should be submitting June in July. We should be submitting July and August, et cetera, et cetera. And we heard from Bay Aging about their process for monitoring invoices. There is a template in the monthly service reports. We encourage you to use that. But on our next slide, we just have some recommendations here for monitoring VDC invoices. So, please, what we heard here, we've provided a link to the customer engagement portal. That's where you're able to get your EOPs, your explanation of payments. You'll be able to see what's been paid, what's not. Please try to use it. If you can't get into it, please bring that up to your medical center first. If you're still struggling, reach out to the veteran-directed inbox that we have here as well. Okay, our next slide. We're going to go back to the daily rate for a minute. So we talked about a daily rate. So you're billing a daily rate for those days in the month when the veteran received personal care. So we're not billing line items. So it's not how much did the veteran spend in day 1 and then day 3 and then day 5. It's going to be the same amount every day, a daily rate. But that daily rate is based on the total spending of the veteran in that month, plus the monthly admin fee. So the veteran's actual spending could be direct care, could be goods, could be transportation if it's in the spending plan. Maybe they needed to tap into their emergency backup and something happened where they needed more care. plus the admin fee. So you would be taking all of that and then dividing it by those days to make sure that's clear. Okay. We just have a couple more questions here. Let's go on. Rebilling. Appendix D of the Billing and Invoicing Guide has a process outlined for rebilling. So both corrected bills as well as resubmitting something that was maybe rejected. So we need you to look at Appendix D, read through it, follow that guidance. Now, what happens if you rebuild, you've tried to solve these issues locally with the national help desk and you're not getting anywhere? Well, on our next slide, and this is in the billing guide as well, but we have a process. If you're not paid, if there's something systemic going on, if you haven't done this yet, we're encouraging you to do it. The email for some reason didn't highlight, but in this first bullet, if you've gone over X number of days and you're saying, okay, I don't think we're getting paid, we've tried to solve this, you need to email the veteran directed inbox. And we need to know the information that are in these sub bullets. Okay. And if you send this to us, we're going to do our best to support alerting the VA and getting to resolution. Now, we don't have a trigger. We don't have a way to go in and look at your invoices. It's not that simple, but if we have this information, we can alert VA. VA will be aware. They can then have their payment experts look into it further. It's not a quick and easy process, but you know, if you're really struggling locally, this is what we need you to do in order to escalate. Now, if your claims, your VDC invoices on the next slide, if they go back to 2019 and 2020, we need to know about it yesterday or today. Let me say that. If you have not communicated it to us already. So we are working with a number of sites. We're aware. If you've emailed our inbox, you probably have heard back, but we do have a record of your challenges. You can reach out again if you're uncertain of that. But if you have not, you know, we need you to email the inbox here with that information that's listed on the prior slide. Late submissions. This is our last FAQ. I'm going to take a big gulp of water because I've been talking fast and quickly. There's a practice, there's a process to follow for submitting claims. And we say late, meaning not over 180 days, because that's its own issue. You need to be invoicing within 180 days. But maybe you invoiced for June, and well, maybe now the veteran's giving you a receipt for something from June. And so you need to re-invoice. That's what we mean. So late submissions would be a late submission from the veteran, not you submitting an invoice late. But now you need to resubmit another invoice in addition to what was invoiced before. There is a process for that. It is in the billing guide. We get specific. So there's a frequency code that goes in the EDI, and you're going to use 347 instead of 346, for example, and it's going to be used to replace that previous claim. We have a process here to say you would actually note how much reimbursement you're seeking, if it's been paid. We're not going to go through that all here, but I do want to let you know that we know that this happens. You know, the veteran finds a receipt, they give it to you 90 days later. Well, you've already invoiced, you've already been paid. We have a process in the billing guide to address that. Okay. We end all of these with a mentee. This was a lot of information. You got to learn firsthand from Bay Aging. We went back and talked about service reports again. We wrapped up with billing and invoicing. We now want to cover one final mentee. So everyone knows how this works. You go to www.mentee.com and you're going to enter code 8788865. And we want to know what's one thing that you would do based on what you've heard today. Can be large, can be small, but just one change that you would implement over the next 90 days. And no one gets to leave this afternoon until we see some submissions. So very interested in what changes you would make. Okay, read the billing guide. Thank you for that. Yes, please, a lot of work went into that from VA and ACL. All right, if I'm sorry, I don't think we promised to give the case mix calculator here. We will follow up on that. I think what we said the last time is we will make sure that the case mix calculator is posted to the No Wrong Door website as soon as it's available. It has been a draft version shared with VA medical centers, but is not yet finalized. Okay, and thank you to those of you that have responded. Electronic billing. If it didn't work, yes, we've had several sites switch. We'd be happy to put you in touch with some of your partners in the community. Signing up for CEP, HSRM, the provider portal, that's great. Yes, if you have outstanding payments from prior years, if you have not contacted the inbox yet, please do so. Again, follow those instructions that were in the earlier slides. Yes, we need veterans to be aware of what they're spending and what their plan is. Okay, that's wonderful. We can stop there. Let me thank you all. We have a closing slide. I'm just going to state a couple quick things. First, we have a survey. We want to hear from you. Any questions we didn't get to. We will likely have a fourth session. I promise we will talk more about the case mix calculator since that came up in the mentee poll. Remember, we have a community, a reporting tool, a mailbox, all here to support you. I greatly appreciate it. Victoria, do you mind wrapping up and closing us out for the day?
Thanks, Pat. As Pat mentioned, please continue to submit your question if you have any more question through the chat box. And then also the recording and the materials used for this session will be available at our No Wrong Door website. And as Pat mentioned, we'll be having a fourth VDC session due to popular demand. And please watch out for the details on our invite. And then also we have our post-event survey. If we would like to hear from you, so please complete that one. And then lastly, we have our community tool. If you love to reach out with Bay Aging, the ACL community, the ACL TA community will be your best option as well. But if you want us to connect with, you with Bay Aging, please send us an email to the veteran directed mailbox. Again, I would like to thank all of you guys for your participation, and a special thanks to our guest speaker, Jennifer and Penny. We look forward to seeing you at our next VDC office hours. Enjoy the rest of the day. Have a good one. Bye.